Hello and welcome to Mississippi Insight. I'm Byron Brown. Thank you for joining us. This week, a community town hall on the COVID-19 pandemic. We'll bring you excerpts from a virtual roundtable looking at the crisis in the Magnolia State. Dr. Dan Edney from the state health department, Lieutenant Governor Delbert Hosemann, UMMC's Lou Ann Woodward, and more panelists examine the impacts on our health, our schools, and our economy, and more. That's all coming up on this edition of Mississippi Insight. Wednesday's virtual town hall was a joint production of 12 News and our partners at MississippiToday.org. Editor-in-Chief Adam Ganeshow and I presented questions from the public to a panel of state and community leaders. In this first segment, we hear from the Health Department's Chief Medical Officer, Dr. Dan Edney, and Lieutenant Governor Delbert Hosemann. They offered some key observations on a pandemic that has killed more than 9,000 Mississippians and continues to sicken thousands of our neighbors. Gentlemen, thank you for joining us this afternoon.
Thanks, Brian.
Thank you. Glad to be here.
Well, Dr. Edney, let's get right to it. Where do we stand right now with the Delta variant across the state of Mississippi?
Well, Byron, we're still reporting very high numbers. Today, we reported out over 2,300 new cases. Thankfully, it looks like we're reaching a plateau, and we've come off the highest zenith that we had previously, where it was 4,000 to 5,000 new cases, but it has not started to come down the backside of this wave yet, and we don't know how long we'll be at this plateau. Our hospitals are doing better. We're having fewer hospitalizations, thankfully, and fewer cases in the hospital, but we still have 1,100 COVID patients statewide in Mississippi in the hospitals. But our ICUs, as Adam said, are still critically full. It's very difficult to transfer to higher levels of care throughout Mississippi. Today, we had 390 in the ICUs, which is a very high number for us, and still running about 280 patients on the ventilators, which again, those are extremely high numbers.
Dr. Edney, for anyone watching or listening who doubts the effectiveness of the COVID vaccines, what do you say to them?
Well, all you have to do is look at what's happening through the Delta variant tsunami. If you look at the total number of cases, only 2% of these cases that are over 2,000 a day are vaccinated. The 98% are unvaccinated. The number in the hospital, we're running about 12% that are vaccinated. So the vaccine's not perfect. It was never reported to be perfect, but is very effective. As you can see, the vast majority in the hospital are unvaccinated, and then our deaths, unfortunately, running too high, but only 13% of those deaths are among the vaccinated, and virtually all of those are over 65 with comorbidities. So the Delta wave really has been a wave that's hit the unvaccinated very hard, and it's hit younger populations, including our children.
Lieutenant Governor Hosemann, we have a couple questions for you about COVID relief spending and the state response to the virus. But before that, I want to ask you about your own experience with contracting COVID-19. As you've discussed before, you had a pretty bad experience, it sounds like, with the virus. And it seems like perhaps that's inspired you to do several things, including becoming a public advocate for getting the vaccine. Can you tell us just a little bit about what your experience was with COVID and whether or not that's kind of shaped how you've led in the months and weeks since then?
Well, I usually don't talk about personal health stuff, but I'm happy to talk about it this time. We, right after our last session, we had to do the budget on June the 30th of last year. We contracted COVID. I guess it was from the House of Representatives. Certainly my senators wouldn't have given it to me. So when we got sick, we got really ill. And as you probably know, I've run marathons and New York Marathon and all this other, and I'm a regular exerciser, let me put it that way. And my goal some days was to try to walk 100 steps, and many days it was difficult to do so. It is a devastating thing. What clearly bothers so much of us, and we were looking at an article about this in one of the papers today, was about what happens post. You say you get over COVID, a lot of times you don't get over COVID. There are body aches and lungs and hearts and minds and foggy and a lot of things Dr. Edney and others would be much more qualified to talk about. But I think all of us that are COVID survivors really wonder a little bit about what the long-term consequences are. And it's very difficult to say what they are at this particular point in time. It's clear to me, I used to run 3 or 4 miles and I couldn't run around the block, a month later. So it takes a while to get over that. And what those long-term ramifications are, Lou Ann Woodward and her research team will find out at some point. But you're right, it affected my particular stance on having you look at your health provider and not some green dots on a screen to give you your health information. Dr. Edney, who used to actually treat my own mother, Dr. Edney cares about whether you live or die or not. The internet, the little green dots don't give a damn one way or the other. So it's amazing to me that people rely on such a non-human event to make a medical decision about themselves. And I'm very hopeful that people will look at what's going on. And we have had an upswing, thank goodness, in vaccinations, and look at what they're doing, talk to their doctor or their healthcare provider, and then make an intelligent decision, not one based on what happened to somebody's friend somewhere else.
Sure. Before today's event, we asked readers and viewers to submit some questions for all the experts that you'll hear from today. I want to dive into a couple of those questions. And Lieutenant Governor Hosemann, I want to start with you. A couple readers asked us about the spending of federal funds. I know that's sort of right up your alley. You've done a lot of work the last few weeks, traveling across the state, trying to decide, how Mississippians want those federal funds to be spent. Two-part question. Can you just briefly recap for us what's been spent in terms of federal funding, stimulus funding so far to this point? And then the second part is, what are you thinking about the next round of federal money, and what do you think that should be spent on?
Good question. You really have to look at this as 3 different tranches. The first was the CARES Act money that we got a year ago, and we put $130 million in healthcare to start. Then, as we realized not all of the money we put in other things like business incentives and whatnot were not claimed by small business, we moved $10 million to ICU and negative pressure rooms, all of which, by the way, were occupied. So thank goodness we did that. We're occupied. The second round that is coming out now allows for us to spend money on water and sewer, broadband, and some on healthcare expenses and mental health. So that will be the ones, $900 million we got, and then $900 million the cities and counties got. Those will be going forward next year in January. And we're asking our cities and counties, as you're right, I think I've been in 50 counties actually, where we go out and ask them what they need. Please do your planning. This is your planning for the future. And then the legislature is going to address additional funding for the things that you think are important in your community. Some of those will include healthcare. We're also looking at one of the things that was mentioned clearly on the start of the program, which is the fact that our nurses are being lured away with additional funds. Now, I talked to one hospital yesterday, had one hospital, and he told me that it was going to cost $175 an hour to get a mobile nurse to come in, a traveling nurse to come into his hospital. And he's paying like $40 to $50 an hour. So it's a huge gap to get that. So what we want to do here in the legislature is look at an interim funding for nurses to stay here in these 12-week periods that we're going through with the virus. And then what I really like to do is a program that we do for doctors, which is if we will pay some or all of your tuition to go to nursing school, if you will agree to stay 4 years in the state. And we do that with doctors. And I just was at their award ceremony the other day. 57 physicians are actually doing that. 57 are going to rural, that's rural only, are staying in rural Mississippi for an obligated period of time in the hopes that they'll stay there throughout their career. I think the same thing applies to the nursing profession. And I think you'll see that coming out of this next tranche.
We'll have more from the COVID Community Town Hall when Mississippi Insight continues. Senator, Dr. Edney, we have a question from Ruth in West Point. Are you concerned about the new variant of COVID-19 and how are we preparing for its arrival here in Mississippi?
And that's a concern a lot of people have. Thankfully, Lambda which came before mu, is not showing to be much to worry about. Right now, Delta is taking all the oxygen out of the room, and there's nowhere for a new variant to enter, because Delta it's at the level of contagiousness as chickenpox, which is extremely high. One person infects 8 to 9 others. So right now there's no room for mu or anything else to get in. The CDC is monitoring that closely, but it has not been labeled as a variant of concern at this point, but we're watching it closely. So right now it's still all about Delta. But the way to attack the variants is through vaccination. These COVID is mutating because it's transmitting too much and replicating too much. And the more that it transmits from person to person, the more opportunity it has to learn and get better. And so the way to do that is to get community immunity up, and that's either going to be through vaccination or it's going to be by recovering from COVID. But as you heard the Lieutenant Governor describe it, COVID is not something that you want to choose to get. Get your immunity the safer way and the way that's easier to deal with, and that's through vaccination. 2.2% mortality in Mississippi with our COVID cases. So you multiply that 2,300 by 2.2%, and that's how many will have succumbed to COVID in about 2 to 3 weeks. So it's just not worth the risk to get immunity naturally. Get vaccinated, which is far safer.
You know, I want to add something to that. Just a couple of weeks ago, we buried a friend of mine, David, in Vicksburg, Mississippi. Dr. Edney would know who that is.
Yes, sir.
He was not vaccinated, 68 years old, in great shape, worked out, ran in the national park, out of the kind of things that you would expect of someone to stay healthy. And he was not vaccinated. And his law partner told me that one of the last things he said to his 3 sons before COVID claimed him was, please get vaccinated. So I will tell you, to echo what Dr. Edney is saying, why are we taking those kinds of chances, not only for ourselves, but our family, our friends, our co-workers, our people at the church, out. You know, when he talks about spreading at multiples of 8 for every person, it's exponential. And then the other thing that I don't know that anybody's talked about, Adam, is the economic loss to us. And when I meet with these hospitals, it costs them $5,000 to $10,000 a day with these patients. And of course, that comes from somewhere. It doesn't come out of the air. It comes from the state or the federal government or the hospitals themselves withdrawing other things they would like to have done that they don't do. And then when you get into the economics of somebody not working, and then you get into I guess really the elephant in the room, how do we sell businesses to come to Mississippi as the least vaccinated state? Is that our selling point? I don't think so. So all of these have a multiplier effect, not just from the actual virus itself, but also from the economic effects that puddle out from us here. And I want to be real clear about that. This is a negative economically, not only to you and your family, but to the whole state.
Absolutely.
Well, Dr. Edney and Lieutenant Governor Hosemann, we could talk all day about this. We have a great panel coming up in just a few minutes. I want to ask y'all one quick question, and we only have about 60 seconds left with this first segment. So if y'all could split that up quickly, I'll ask an easy question. What can we do about this? In your opinion, what can we do to help encourage Mississippians in the least vaccinated state in America, to your point, Governor? What can we do to spread the word and get these numbers looking a lot better?
Dr. Edney?
Well, it's important to, in a non-judgmental, loving fashion, talk to your friends and family about the importance of protecting yourself through vaccination. Or if you're just not going to get vaccinated, then wear your mask and be appropriate, and don't take unnecessary risk until this is over. And just understand this is not over. We still have a ways to go. But judging each other doesn't get us anywhere. We need to be concerned about each other.
I think that was very well said, and I don't have anything to add to it. The state's going to support our hospitals, our nurses, and our doctors that are dealing with this, and the families that are left behind. But we would like for that to be minimal.
That's Lieutenant Governor Delbert Hosemann and Dr. Dan Edney from the State Health Department. Next, the focus turns to COVID-19 in our school systems. You're watching Mississippi Insight on WJTV. Welcome back. The pandemic's impact on teachers and school children came into focus in Wednesday's virtual town hall. And questions from the public indicate COVID-19 remains a huge concern for parents and educators alike. Here's Mississippi Today's education reporter, Kate Royals, with more of your questions from our panelists.
It's from Maggie Pooley in Ridgeland, and I think it's probably a good one for Dr. Edney or Dr. Woodward. And it is, how effective are face masks really in schools?
Well, in terms of mask work, period, and we have proven that. We just had a large study that was reported demonstrating the effectiveness of masks, but all of us in healthcare can tell you, I mean, I think part of the reason I survived until I could be vaccinated was because of the ability of masks to protect me. And, obviously we've been wearing surgical masks forever, and there's a reason. And the surgical masks don't filter all the bacteria and viruses, but it reduces droplet transmission, and it reduces the bacterial and viral load as it goes through the mask. There are a lot of reasons why masks work, but you look at the influenza season last year, it was non-existent because we were all masked and socially distancing, something we had never done in my 30-year career. And already flu is in Mississippi. We're seeing COVID and flu together because we've dropped our mask. There are times when it's appropriate to wear a shirt, and there's times it's appropriate to wear a mask. And, I'm not going naked face to Walmart. I wear my mask.
Dr. Lacey and Dr. Coleman, what do y'all see in your school system? I know, Dr. Lacey, you're in an elementary school, a principal there. So how's it with the little folks, getting them to wear the mask properly and everything?
Well, they're precious. They'll do anything we ask them to do. And it's important that we're modeling what we expect them to do. So our teachers are doing a great job, whether they're vaccinated or not, keeping their masks on while they're here at school. They'll only take them down unless they're in their 6 feet teaching zone, 6 feet away from the closest student. So, but what we've noticed, we've had more cases this year than we have in the past, but we have not noticed the spread in the classrooms. And I definitely attribute that to the masks. We feel like the spread's coming more so from, outside of the school. So we definitely have seen an increase in children being well at school, even as far back as last year, as was just stated in regard to our nurse visits.
Right. I agree. I think, none of us expected to be in our 3rd school year still dealing with COVID, but yet here we are. We are a system, just as Pastor Shan, that has been masked all year. I will tell you that surprisingly, it was a lot easier for us to convince our little ones to mask than sometimes our older students. But with that being said, because we are so committed to staying in school, to staying in person and traditional as much as possible, our students have been absolutely phenomenal in doing everything that we've asked of them. So we continue to strive in this environment, but at the same time, I think all of us, of course, are looking forward to the day when all of this is over.
Thank y'all.
And I'll just one more little twist on the mask piece. Here at the medical center, we are also a school. Not everybody always thinks about that, but we've got about 3,000 students. So, and our education programs, it's very hard for those to be virtual. We do have some components that can be virtual, but when you're learning how to take care of patients, so much of that really has to be in person, bedside, with the physicians, with your nursing professors, with your dental professors, all of those. So we have been in person pretty much throughout the entire pandemic, and our students have been wearing masks. Even before the vaccine was widely available, people were wearing masks. We had a few little outbreaks in our student population, but that was primarily tied to social events outside of school. So we felt very good with our own students, though they're a little bit older than yours, but we felt very good with our own students and how well they were protected by wearing masks.
And it sounds like having a culture of safety is prevalent among all of the school districts, whether they are of adults or of elementary, middle, or high school age children. Having a culture of safety is very important. And so that's something that as parents, we could encourage, whether we believe in the vaccine or not, whether our families are vaccinated or not. Having a culture of safety is something that we can promote in our homes to support the school districts.
We'll have a final word after the break. Big thanks to Adam Ganeshow and the rest of the Mississippi Today staff for their excellent work in producing this week's COVID Community Town Hall. You can watch more from this online discussion at MississippiToday.org. We'll be back next weekend with more of the political and current affairs coverage that you demand. I'm Byron Brown. From all of us here at 12 News, make it a great weekend.